Welcome everybody. Thank you for being here this morning. It's probably a good time to start something like this because this is EMS week. So happy EMS week to all the first responders. First, I want to acknowledge the people that are here today. First off, I want to acknowledge our town manager, Howard Tipton, who's very supportive. He's wearing our shirts that we'll be wearing the month of June. We had a citizen that provided the funding for the shirts, so all the firefighters will wearing that the month of June. I also want to recognize Sarasota Memorial Hospital for being here today. Dr. Brown, Susie, Tim, and Kelly. This has been a big project for us to take on, and they have been really very much supportive of what we're doing. And you know, the firefighters all have a union here in Manatee, Sarasota, and I want to recognize the union secretary from the International Association of Firefighters, Local 2546, and that's our secretary, Jason Brzezowski, so thanks for being there. Sarasota County Fire Department's here today. Many members of the Venice Fire Department here today. West Manatee is here, East Manatee. Thank you guys, West Manatee. Thanks for all for being here. So about this time last year, we wanted to work on a program for, I forgot about Northport. Sorry, Chief Gorski, and Northport. He's sitting there going like that. Yeah. About this time last year, we met with some of the fire departments. We wanted to do a program for the Cancer Initiative. Some of the departments had something going, some of them didn't. So we wanted to try to get the Sarasota and Manatee Fire Department together to do a coalition. And during that process, we met with Sarasota Memorial. And I met with Kelly initially to tell her what the concept was, and right away, boom, she took it. She said, absolutely, we'd like to do something with that. She brought it to the medical director, Dr. Brown, and Dr. Brown was all on board with doing that. So again, we appreciate that. But you know, when the firefighters joined the fire department, we knew it was a dangerous job. What we didn't know was that over a period of years, the cumulative effect, what it would cause on our bodies. And that we're just learning that now. And so having a program in place, the initiatives that are set forth by the International Association of Firefighters and the fire chiefs is something that we want to continue to work with. You know, there's many risks that firefighters take, and one of them we're learning more and more about would be cancer. There's all forms of types of cancer that are out there. And when you look at the different forms of cancer, they're all related. Many of them, I should say, are related to the job that we perform. Even with the personal protective gear that we have, they're expensive. You know, we're talking $5,000 plus the air tanks that we wear, the masks that we wear, the hoods that we wear, all those things that we wear. It's still a chance for us to have that chemical absorbed within our system. So what our goal was in this program was to provide education and prevention to the firefighters. Just like the town manager, Mr. Tipton's wearing those shirts, education and prevention is what we're going to be doing here within Longboat Key Fire Department and making sure everybody is aware of it. We have had, like you guys, the fire departments have had, members that have had cancer. We have had our share. We only have 33 members here in the department, but we've had our share of members that had cancer and still going through the process of cancer treatments. So working with the Brian D. Jellison Cancer Institute, the staff of Sarasota Memorial, we really have a partnership that I think is super. There's not one time that I have not gotten a positive response from Kelly and her team. And anything that we've come up with, they said they grab on, they said, yes, let's do it. And so I again, on behalf of us here in this room, thank you for doing that for us. You know, as fire chiefs, we want our members to be safe, and we want to do what's best for them. You know, we do provide annual physicals to our firefighters. The problem that we have is the firefighters are not doing a follow-up. So when a firefighter has a questionable scan or a questionable test that they have, a lot of times because they're young, they decide that's not something they want to follow up on. And that's why it's important for us to make sure that all firefighters are doing a follow-up care to their physician. You know, Longboat Key Fire Rescue has implemented the cancer initiatives with our fire stations. We built 2 years ago fire stations here that we use the red, yellow, and green light method, meaning when the firefighter comes back from the fire call, they're not to enter the fire station with any of the uniform or gear that they wore while they were on the fire. We have a shoe policy here as far as if firefighters can take you'll see guys today walking around with Crocs. We allow them to do that because they're not part of any carcinogens or walking in ashes or something like that, so that's kept out there. We also have built the fire station where the firefighters get 2 showers before they come inside the fire station, what we call the green area. They have to make sure that they get the 2 showers and shower off the soot off their body. We make sure that the uniforms are clean. We have a washer and dryer that's in a decon room, along with equipment that extractor that cleans the fire gear. So that is all kept what we call in a yellow area. That's the yellow part of the department. Decon's yellow. And then once they're done, inside the cabins and the bathrooms, everybody has a pair of shorts and a t-shirt and socks and their shoes that they can wear to get into their bunk room and change into their uniform again. We also implemented a program if we have a fire, the units go out of service for 1 hour, allowing them to get cleaned up and get back into service. So we've implemented those types of programs here in this department, along with making sure that we have vents inside the garages of this station, so that when the units are started up, these vents come on and take out the diesel fuel or fumes out of the area. We have a duty and responsibility to ensure our members get the best protective equipment, provide the best training possible, receive the annual physicals, and finally, if anything is diagnosed, that we make sure they get the most appropriate definitive care. And that's why we wanted to get with Sarasota Memorial healthcare services, so they are healthcare services, so they understand the process we have to go through in order to get the treatment we need. They have a navigator, which is what Susie is, and I know that Kelly is going to share that with us today. And like I talked about earlier, an area that we must stress to our members is the importance of follow-up care, and that's a big thing that we're doing here at Longboat, making sure that these guys are following. Under HIPAA, we don't really know what the scan or the physical says, but we want to stress the importance of it. Nobody wants to get a colonoscopy. Nobody wants to get it done. But if you have history of that in your family, you need to go get it done. Okay, it needs to be done. Another thing too to keep in mind is that all these initiatives that we have within the fire service, we still expect the firefighter to do the right thing as well, meaning that living a healthy life, right, on and off duty. And so we, along with all this initiative comes along off-duty type of things as well. So we can't stress that enough to the firefighters here. So with that, I appreciate everybody being here. I want to turn it over to Kelly with Sarasota Memorial, and she'll follow up with any further information. Thank you.
All right, now I'm navigating here. There we go. Hello, thank you very much for all being here today. My name is Kelly Batista. I'm the Executive Director of the Brian D. Jellison Cancer Institute at Sarasota Memorial. I want to first and foremost thank Chief Dezzi for bringing us all together about a year ago when we first started our conversation, and then to be here today with all of you is an absolutely wonderful thing, and it really shows the support and interest that our local fire chiefs have for all the firefighters in the region to support them in their health care. What I wanted to share with you today about our program, our new Firefighter Cancer Collaborative, is the focus on it being truly a collaborative, and not just a program that is one direction, but is bi-directional. It's information and education that's provided by the Jellison Cancer Institute to our local fire agencies, and the support that we can provide to those team members or their families who may become diagnosed with cancer. But it's also a collaborative in that it requires the support of the local fire chiefs, such as yourselves here today, to make sure that your employees and the members of your team are not only educated, but aware of what they can do to care for themselves and their loved ones. As Chief mentioned earlier this morning, it's wonderful to hear not only about the focus on education and awareness, but also the support in prevention of a cancer diagnosis through all of these new techniques and new policies. Where Sarasota Memorial can also add to that is helping all of your team members understand their risk for cancer, their risk as an occupational hazard, their risk as a personal or genetic predisposition to cancer, and how can they, as members of the public, take care of themselves and follow up with their cancer screenings, or if there is a suspicious finding, know that we're here to help take care of them. That is part of the vision of the Brian D. Jellison Cancer Institute. It's something that Sarasota Memorial embarked on about 6 or 7 years ago. The vision of that was that we knew we could do better in providing true cancer care here in our community, for our community, and that they don't need to leave to have excellent treatment. So our look at cancer care starts from a continuum of education and screening, as the chief just mentioned. It's about making sure that the population is aware of what they can do to improve their health. But that goes beyond education and into that time when someone may become diagnosed and then need that support through their cancer treatment. How we've tried to bring that program together and make it more comprehensive for the community and working together with agencies such as yourselves is through our navigations program. So we invited one of our navigators here today. Chief Paul Dezzi mentioned that Susie is here with us. She is one of our GI oncology nurse navigators. Our oncology navigation program are experienced, certified oncology nurses that are dedicated to specific tumor sites. So as members of your team or their loved ones may have a suspicious finding or a confirmed diagnosis of cancer, they now have a point person in our navigation team that they can go to, ask questions. Where do I go from here? Many times a suspicious finding or a diagnosis, it's very scary for the individual or their family members or their caregivers. And understanding that they have someone who understands what they're going through, who is very educated in the next steps that are available to them, and knows the right members of the care team to go to make sure they have a seamless process through their care, is of utmost importance. So that's where we want to be able to support your team members who may be going through something like that. In addition, what we've been bringing here to the community that we want to educate your team on is the availability of the expertise locally. So Chief Dezzi mentioned that there are more cancers that are being discovered as tied as an occupational risk of firefighting profession. That may be things like thyroid cancer or colorectal cancer. And so bringing all of those expert oncologists here locally from places we have, such as Mayo Clinic or Johns Hopkins, allows that team here to know that they are in expert hands. They have access to all of those oncologists, surgeons, medical oncologists, or radiation oncologists to care for them here locally. Just as much as we want to identify that we are two local agencies that are coming together to support one another, we are also here for your team and for their loved ones. So thank you again for being here today, showing this great support that you have for all of your agencies, and we're just very thankful to be working together in this partnership. And I'm going to introduce Dr. Brown to come up and talk about where we are now with this program and what we're seeing nationally and where we'd like to go locally for the future. Thank you.
Thank you, Kelly. Have to forgive me, I wasn't aware actually I was speaking today, and I'm not nearly as polished as Kelly. So I'm Dr. Richard Brown. I'm the medical director of the Cancer Institute. By trade, I am a medical oncologist, and I've been doing this now for around 30 plus years in Sarasota. So let me just tell you what we do know, because there's a lot of things we don't know we need to find out. We do know that cancer is a multi-hit process. So you have your genes, those are what you're born with, can't do anything about it other than understand that you may be at risk for cancer by virtue of your family history and what you inherited. And then there are these other factors, environmental factors. So we know that all cancers are two hits: what you're born with and then environmental factors. So for instance, the vast majority of people who smoke do not get lung cancer, but 80% of smokers will get lung cancer. So even if you smoke, there's only a 10 to 15% chance you're going to get it. So we know there's more things in operation here. So we need to understand, everyone needs to understand what's going on in them as well as their environment to try and mitigate these things. We also know that firefighters, by virtue of what they do, are at higher risk. Okay, we don't 100% understand that, but we understand that there are multitude of agents that you get exposed to on a daily basis that are carcinogenic in their nature. Some of them are clearly known to be carcinogenic. Some we suspect, and a lot of this has to do with on population studies, which we don't know, but certainly, hydrocarbons, pH, arsenic, asbestos, silica, benzene, and as well as radiation that you may get exposed to in your occupation. I think they did a study that showed that there were thousands of agents that people were exposed to when the Twin Towers came down. And they're still trying to work out exactly what those exposures were. So we know that there is around a 15% greater risk of developing or dying of cancer if you're a firefighter than the general population. So that's actually a pretty high number. So that's 15%. The way I look at it, that you guys should not have to have. So if it's there and it's due, we need to do everything we can to understand what those risks are, try and mitigate them any way we can, and certainly by educating you and by understanding that any cancer, if you catch it earlier, is better than if you let it go. And that is, unfortunately, as Kelly alluded to, firefighters tend to be younger and fitter, and they tend not to think anything's going to happen to them. Well, unfortunately, that's not correct. So you have to let everyone know in your crews and your membership that they are at risk and that they need to follow through if they suspect something's going on, and again, catch things early by virtue of screening. We know that there's risk for thyroid cancer, prostate cancer, aerodigestor cancers, throat, head and neck, lung, and GI cancer, colorectal, as well as bladder cancer. The material gets into your blood, it gets excreted through your kidneys. There's also, by the way, kidney cancer, and then gets in your bladder where it sits. So there's a higher risk for bladder cancer. So there are a variety of ways of screening for this. Everyone should be aware of those, and they need to be followed very, very religiously. I've personally, unfortunately, had the chance in my 30 years of taking care of multiple members of the fire department. And I can actually, thinking back, I was sitting here thinking about it, and I've had a colon cancer, a rectal cancer, a lung cancer, a thyroid cancer, but what really struck me was a gentleman who actually sort of became friends with was a young firefighter in Sarasota who get prostate cancer, and he was around 41. And unfortunately, he succumbed to the prostate cancer, but he had young kids, and he did his best to try and fight it, but befriended me enough that he invited me to the station and actually gave me a T-shirt that said Chief Brown on it with the logo on it, which I still actually have and came in handy when I was Chief of Staff, though the rest of the medical staff didn't quite appreciate it when I wore it. But if you ask me, that was an unnecessary death. Clearly, he may have been at risk. He really didn't have a family history, but something he was exposed to caused it. And this is what we need to fix. So we need to make sure that people like that do not have an untimely death because you guys are going out there doing your job and trying to help people and save lives and save buildings, but you shouldn't be put at undue risk because of things you're exposed to. And unfortunately, that is part of the job for you right now. And hopefully, again, with understanding what those exposures are and coming up with ways of mitigating it, we will be able to improve upon those numbers. But for now, it is what it is. So you just need to do our best at education and prevention, as Kelly said. So you need to understand what those risks are. Two, we need to make sure that everyone is getting the appropriate screening to try and get those cancers caught at the earliest possible stage. And for a melanoma, we're talking about a millimeter making a difference between life and death. So 0.5 millimeters, you're okay. At 4 millimeters, chances are you're gonna probably die of melanoma. So those are things that are very serious, and skin cancer is one of the things that we're seeing in higher rates in firefighters. So catch it earlier, and then if you do have it, then we want to be involved in making sure that you all get the best possible care. And that's where navigation comes in play, and that's where making sure that we can provide the best possible care in terms of having the experts at the Cancer Institute available for you.